So I'm happy at the AAN I've gotten a chance to show something new in some work that I've done for a long time. So I've worked on something called the topographical model of MS, which has been a way of visualizing disease course in multiple sclerosis. It's often referred to as the leaky swimming pool model, and it's this idea that there's a pool of reserve that allows people to compensate for disease burden, for lesions. And then there are lesions under the surface, some of which become clinically apparent and many of which stay kind of hidden under the clinical threshold. But for these last several years, anytime I've shown the topographical model, it's been archetypes. It's been sort of a concept about MS disease course, but never real patients, never individual people. So what I'm showing here at the American Academy of Neurology this year is the very first attempt to take quantified brain MRI, map the lesions and their localizations to the areas in the topographical model, and show a true sense of disease burden using the topographical model concept. So I've done this in collaboration with people from Octave that have developed a 3D brain imaging technique. And using their technique, we were able to extract lesion burden in different regions within the brain, so in the hemispheres, in the brainstem and cerebellum, and show left and right side of the brain, front and back of the brain, and all the regions of interest in the topographical model, and map individual patients' lesion burden. And so the poster that we've shown allows kind of a 3D visualization of that. And what I hope comes from it is a sense that you can actually use the topographical model concept to envision the disease burden in an individual patient. And next steps should be to try to figure out how to show reserve in this way of visualizing the disease, brain volumes, and ultimately a more personalized depiction of disease course.